Hi and welcome to today's vlog. Today I am talking you through what you can expect from a general surgery pre-op assessment.
She likes oversharing with outfits and swearing, admiring her tats while she plays with all her cats. Her disability gives her superpower, agility to holiday and live the right way. Stellosaurus.
So generally speaking, pre-op assessments are planned for your surgery. So 9 times out of 10 you will already have a date for your surgery when you get your pre-op assessment. Sometimes you won't, sometimes they just do a pre-op assessment so that you're ready. A pre-op assessment lasts for a period of 12 months from the day you have that assessment. So in theory, if you have your pre-op assessment, you could take a short notice cancellation for a surgery, which is one of the ways the NHS is working to clear their backlog at the moment. So it makes sense and it's a good idea. I had a pre-op assessment this week for spinal surgery, for lumbar spinal surgery. I do not have a date yet. The nurse said she doesn't expect it to take 12 months, so hopefully I might get a date soon. That would be nice and I could stop worrying about the surgery. So yeah, today I thought I would take you through what you can expect from a general surgery pre-op assessment, the steps, and just basically hopefully ease your mind if you're having to have one, if you're worried about it, if you've never had one, you're not really sure what to expect, or if you're just curious. So generally pre-op assessments are much of a muchness. You're going to get the same sort of thing regardless of what surgery you're having. Some surgeries will require extra tests or extra questions or extra preparation, I guess, but generally general surgery pre-ops will follow the same sorts of procedures. First up, I was given the appointment and I headed to my local hospital. So when I received the letter for my pre-op appointment, I was sent a health questionnaire, and you probably will be too. So when you're first sent your appointment, you will most likely be sent a health questionnaire. It's straightforward, standard questions, and it asks you things like past medical history, what meds you're on, previous surgeries, previous reactions to anaesthetics. It'll ask you if you've got heart conditions or breathing problems or anything like that, sort of your standard health question stuff. It'll ask you if you're pregnant, a history of CJD, all that kind of stuff that they need to know prior to the surgery. So my advice is definitely fill that questionnaire out before you go. It will save you a little bit of time. If you don't know the answers to the questions, or if you're not sure about the questions, leave them blank because the nurse will go through that questionnaire with you at your pre-op. So I arrived and I checked in, and luckily I didn't have too long a wait. My appointment was in the morning. They do advise that for a pre-op you should leave sort of anywhere up to 2 hours for the pre-op assessment appointment. It might not take that long, sometimes it does. I've had pre-ops that lasted 10 minutes. I've had pre-ops that lasted the full 2 hours. So whilst it might not take 2 hours, certainly leave yourself that amount of time just in case. When I arrived, the department wasn't too busy, so I wasn't expecting too much of a wait. Just bear in mind that when you are sort of at a pre-op assessment, there will be lots of other people there at different stages of their pre-op appointment. So if it looks like people are arriving after you and being called for you, don't panic too much. You haven't been forgotten. It's just likely that they're at a different stage in the assessment. So on the wall in my outpatients department was a very handy chart of what you could expect from your pre-op assessment, which I'll pop in here.
They love each other so much. Yeah, you could tell.
First up, I saw a very lovely HCA, healthcare assistant, who did my basic obs. She took my blood pressure, you know, with the cuff, and she took my SATs and my pulse ox and stuff with, you know, the little probe that goes on your finger. So yeah, she did my blood pressure, she did my pulse. She asked me prior to doing my blood pressure if I have any normal problems with my blood pressure, just because then if my blood pressure was overly high or overly low, they could know whether it was a cause for concern or just normal for me. As it is, I do occasionally suffer from low blood pressure, so I mentioned that. She also took measurements of my neck and of my lower leg. Lower leg for the compression stockings that they make you wear for certain surgeries. You don't always need them, but if they measure them at your pre-op, they can have the right size ready for you on the day of your surgery. Just saves a little bit of time. She also measured my neck, and that's for the anaesthetist in case I needed a sleep apnea machine during the surgery. Likely you'll need one, but again, it is better to have the measurement there and the equipment ready to go than it is need it and not have it ready. So don't be concerned at them taking these measurements. They're just sort of to save time if needed. So once that was done, I went back out into the waiting room and waited to speak to the next person. Next up was a registered nurse, and she went through the health questionnaire that I'd filled out prior to the appointment. She also completed my booklet. So the booklet is what will go with you during your surgery and into hospital. So it's got all your allergy medication, your allergy information, your current meds, your date of birth, your next of kin, your emergency contact details. All of that kind of stuff is already in the book, and she will double check and go through all of that with you. She went through my entire health questionnaire a little bit more in depth. She asked me some more questions. I've got a very complex past medical history, so we discussed that. We discussed the implications of me having surgery and sort of the implications of my PTSD and my catheterization, that kind of thing. We discussed all that. They also go through your current medications. So I will say it's a really good idea to take either a list of your current medications or your repeat prescription card, or if you've got the NHS app and you're signed in and registered, you can also access all of your prescriptions through the app. So if you've got any of those things, that's really useful to have and take with you so that they can copy a list of your medications, and they ask you that they check the dosage and when you take them, so that can all be written into the booklet. If you're an inpatient, you'll have to take those drugs with you, and they'll have to give them to you on the drugs round, so they need them all listed so that they can be given to you when you are an inpatient. So once I'd done all that, we went through all the questions. I asked any questions, so that was her part done. She then gave me a whole bunch of leaflets and some very exciting chlorhexidine solution and Septin nasal spray. Now these are for if you are having spinal or back or some orthopedic surgeries. They will give you these to wash in. This is to reduce the risk of MRSA, which is pretty rife in hospitals. These will reduce that risk. There's a nasal spray to use prior to the surgery, and there's also this body wash and shampoo to use prior to the surgery, and they do give you a leaflet of how and when to use these. So when you're given your surgery date, you will be told at what point you should be using these, and just make sure you use them prior to the surgery as told. It just reduces your infections, just to keep you safe. It smells horrible, it's bright pink, it can stain your tiles a little bit, so just watch out for that. But yeah, use them as directed prior to your surgery. So the other leaflets that I was given was this planned surgery booklet. You will get something similar to this for your local hospital. This is obviously for my local hospital, but it basically tells you what you should take into hospital with you for a planned admission, eating and drinking instructions prior to a surgery, admission, the surgery, recovery, anaesthetic, everything just in sort of a really easy to read guide. It's worth having this, it's worth reading through it. It's also got in the back some handy sort of questions you might want to ask your surgeon, things that you might want to think about, things you might want to prepare. For example, if you live alone, it's really worth preparing meals and stuff before you go into hospital, so that it's a little bit easier for when you know, a little bit easier for you when you get out. So you'll get that booklet. I also got this booklet, which is the Fitter, Better, Sooner booklet. This is one of the new sort of government initiatives, and this is basically if you're thin and you don't smoke, you'll recover quicker. Any excuse to tell us that we're fat, I guess. So this little booklet, whilst irritating, is full of some quite useful information. And obviously, you know, being overweight does have complications. Being a little bit more active, stopping smoking prior to surgery will help you heal faster, in all fairness. This book also has some handy practical preparation for your operation tips. So it tells you how you can pass the time, like by bringing headphones in for your surgery. So actually a fairly useful little booklet. And when I have my surgery, when I've got my surgery date, I will go through everything I do to prepare for a surgery. So look out for that vlog when I get a date. Next leaflet I got is just a leaflet that tells you what you should do with your medications, when to bring them, what to bring, when to stop taking them, what to stop taking. I then got a handy leaflet on what to expect from having a prone surgery. I'm having spinal surgery, so I will be in a prone position for the general anaesthetic, and it just tells you what to expect from that. For example, facial swelling and joint stiffness and pain. So I got that leaflet about prone surgery, and you will likely get leaflets specific to your surgery. So for example, if you're having a colorectal surgery, you might get leaflets about bowel prep. You will likely get leaflets related to whatever surgery you're having. So make sure you read through all of that. Keep it, read through it, look after it. It is good to read it and put your mind at rest. And the last leaflet I got was this COVID leaflet. So COVID obviously is a fairly, well, I say fairly new, it's not fairly new, but they've had to introduce new sort of measures since COVID. Now, when I had my surgery in 2020 and 2021, we were very much still in the midst of COVID. So I had to have PCR tests and I had to isolate prior to my surgeries. This time around, if you are a patient who is having an inpatient stay following your surgery, or if you are a day case patient and you haven't been fully vaccinated, you're having to take a lateral flow test 72 hours before your surgery. So once you know your surgery date, you will need to order a lateral flow test, complete that lateral flow test, upload the results and keep proof of the results prior to your surgery. They will ask for it, and if it is positive, you will need to contact them. For those handy leaflets, all of that stuff was given to me. I got it to take home in a lovely green bag. Also, this bag, it's a patient medicine bag. So if they give one of these to you, when you go into hospital for your surgery, you can pack all of your current medications in here, which will make it a little bit easier for when you're an inpatient. But I'll go through that in more depth another time. That was that. Once I'd seen the nurse, collected all my leaflets, I headed back out to the waiting room and I waited for a little bit longer, and then I saw another HCA who took some bloods. Bloods are bloods. They pop a small butterfly needle somewhere in a vein, somewhere in your arm. They take some blood and then that blood goes off to be tested just to make sure, you know, everything's okay and you're good to go for surgery. You then have MRSA swabs taken. Now, MRSA swabs is basically a very long cotton bud that they shove in various places. If you've ever had a PCR test, you will know what this feels like. The cotton bud goes up into the back of either side of your nose and into the back of either side of your throat. A different swab is then put either side of your bikini line, and then those swabs go off and are tested for MRSA. And that's that. It's completely unpainful. It's uncomfortable when they shove up your nose more than anything, but if you've had a PCR test, you'll know what that feels like, so it's nothing to worry about. Those swabs go off and that's it. At this point you might be asked to have an ECG. I wasn't this time. I have had ECGs before prior to surgery. I didn't need one this time. And at this point you'll also have any other tests relevant to your surgery. After this, you will then usually see your consultant. So whoever is doing your surgery, you will see them at this point and you can ask them any questions. They'll go through the surgery with you, they'll go through the risks with you, they'll go through what you can expect from recovery and how long recovery will take. At this point you should ask for a sick note if you need one, and then they can prepare that ready for when you are admitted. If you've got any questions, ask them at this point. And then after that, you will see an anaesthetist. Again, they will go through what you can expect from being anaesthetised. And if you've had any prior issues with anaesthetics, for example, I have very low blood pressure and I get very, very nauseous when I have anaesthetics. And I'm also really, really difficult to cannulate. So I mention all of this at that point, just so that they're aware and they can make any adjustments as necessary. And again, you can ask them any questions you've got. You can ask them what to expect from sort of recovery, what sort of painkillers and epidurals and things they're going to give to you, all very important stuff. They'll also go through sort of your allergies and that kind of thing with you, and they'll also talk about your if you have breathing difficulties when you sleep, how many pillows you sleep on, that kind of thing. And it's all just to gauge sort of, you know, how much anaesthetic and what kind of anaesthetic and stuff they're going to give you. And usually at this point you will have signed a consent form. You will sign more consent forms on the day of your surgery, but they quite often get you to sign a consent form at this point just to say that you're happy to go ahead with the surgery. And if you are, off we go, and that's it. And then that's it really. You're free to go home unless you need any sort of other tests. You're pretty much free to go home at this point, and that is the end of your pre-op assessment. Like I said, it's a really simple, painless thing. Unless you don't like needles, the only painful bit, I guess, is having your blood taken. But other than that, it's a really straightforward process. Same for everyone. You know, it deviates a little dependent on what surgery you're going to have. But the pre-op really is your chance to ask questions. If you're worried, if you've got questions about anything, write them down before you go and ask them. No question is too stupid. Ask any questions you like. If you've got any worries, if you've got any fears, any questions at all, ask them at this point. You can obviously ask them further down the line. You can ask them whenever you want, but the pre-op is a really good opportunity just to sort of get a grasp of what's going on, alleviate any worries you might have, and give you a chance to sort of prepare for the surgery. So ask your questions, write them down before you go, ask them when you get there. And like I said, no question is too stupid. So that's it. Really, that's what you can expect from a general surgery pre-op. It's not going to be much different. Most general surgeries follow that same pre-op procedure. Some can change a little bit dependent on what your local hospital's procedures are, but generally that's what's going to happen. You'll have some obs taken, you'll answer some questions with a nurse, you'll see your consultant, you'll see your anaesthetist, you'll have some bloods taken, you'll have some MRSA swabs taken, you'll get loads of stuff to read and some beautiful pink body scrub dependent on what surgery you're having. So that's it. If you've got any questions about what you can expect from a general surgery pre-op, please drop them below and I'll try my best to answer them. And hopefully you found this video useful or interesting. And that's it really. So thank you as always for watching. Don't forget to like and subscribe, and I'll be back soon with another video.